Hello everyone, and welcome to our comprehensive guide on a vital health topic for our senior community. Today, we're delving into high cholesterol and atherosclerosis, two interconnected conditions that significantly impact heart health, especially as we age. It's a topic that often brings questions and concerns, and rightfully so, because understanding these conditions is the first step towards a healthier, more vibrant life. Many of us have heard of cholesterol, perhaps in the context of good and bad types, or about the risks of heart disease. But what exactly are these conditions? How do they affect seniors differently? And most importantly, what can we do to manage and prevent them? In this video, we aim to demystify high cholesterol and atherosclerosis, providing you with clear, empathetic, and practical information. We'll explore everything from the basics of cholesterol and how plaque builds up in our arteries, to the causes, symptoms, and the crucial steps you can take, both at home and with medical guidance, to protect your heart. Our goal is to empower you with knowledge, helping you make informed decisions about your health journey. So let's begin this important discussion together. To truly understand high cholesterol and atherosclerosis, let's start with the basics. Cholesterol is a waxy, fat-like substance found in all your body cells. Your body needs cholesterol to make hormones, vitamin D, and substances that help you digest food. Your body makes all the cholesterol it needs, but you also get cholesterol from foods, particularly animal products. Not all cholesterol is the same. We commonly refer to two main types, LDL, or low-density lipoprotein, often called bad cholesterol, and HDL, or high-density lipoprotein, known as good cholesterol. LDL transports cholesterol particles throughout your body. If you have too much LDL cholesterol, it can build up in the walls of your arteries, making them hard and narrow. HDL cholesterol, on the other hand, picks up excess cholesterol and takes it back to your liver for removal from the body, essentially acting as a scavenger, cleaning up your arteries. We also consider triglycerides, which are another type of fat in your blood. High levels of triglycerides, especially when combined with high LDL or low HDL, can also increase your risk of heart disease. Now, let's connect this to atherosclerosis. Atherosclerosis is a serious condition near plaque, a sticky substance made of cholesterol, fat, calcium, and other substances, builds up inside your arteries. Arteries are blood vessels that carry oxygen-rich blood from your heart to other parts of your body. When plaque builds up, it hardens and narrows your arteries, making it difficult for blood to flow through. This can lead to a range of health problems. Imagine your arteries as clean, flexible pipes. With atherosclerosis, these pipes become stiff and clogged, like old plumbing. This process doesn't happen overnight. It develops gradually over many years, often starting in young adulthood and progressing silently. In seniors, this process is often more advanced due to years of accumulation. As we age, our arteries naturally lose some of their elasticity, and the cumulative effects of diet and lifestyle choices become more pronounced. Furthermore, the body's ability to clear cholesterol might become less efficient, and chronic conditions more common in older adults, such as diabetes and high blood pressure, can accelerate arterial damage. The risks associated with advanced atherosclerosis are significant. Narrowed arteries can lead to a reduction of blood flow to vital organs. If this occurs in the arteries supplying the heart, it can cause chest pain, known as angina, or even a heart attack if the blood flow is completely blocked. If it affects the arteries to the brain, it can lead to a stroke. In the legs, it can cause peripheral artery disease, resulting in pain and difficulty walking. Understanding these foundational concepts is crucial as we move forward to discuss causes, symptoms, and most importantly, how to manage and prevent these silent threats to our health. Now that we understand what high cholesterol and atherosclerosis are, let's explore the various factors that contribute to their development, particularly in seniors. Some of these factors are within our control, while others are not. Let's start with the non-modifiable risk factors. Age is a primary factor. As we get older, our bodies naturally process cholesterol less efficiently. The liver's ability to remove LDL cholesterol from the blood diminishes with age, leading to higher levels. This is why seniors are at a higher risk. Genetics also plays a significant role. If you have a family history of high cholesterol or early heart disease, you may be genetically predisposed to developing these conditions yourself. This doesn't mean it's inevitable, but it does mean you need to be extra vigilant. Sex is another factor. Before menopause, women typically have lower LDL cholesterol levels than men. However, after menopause, women's LDL levels tend to rise. Now, let's focus on the modifiable risk factors. These are the areas where we can make a significant difference. Diet is perhaps one of the most impactful. A diet high in saturated and trans fats can significantly raise your LDL cholesterol levels. Saturated fats are found in red meat, full-fat dairy products, and many processed foods. Trans fats, often found in fried foods, baked goods, and some margarines, are particularly harmful as they not only raise LDL, but also lower HDL cholesterol. A lack of physical activity is another major contributor. Regular exercise helps increase HDL cholesterol and can lower LDL cholesterol and triglycerides. A sedentary lifestyle, common in many seniors, deprives the body of these protective benefits. Obesity and being overweight, especially carrying excess weight around the abdomen, can increase LDL cholesterol and triglyceride levels while lowering HDL cholesterol. This creates a dangerous profile for heart health. Smoking is extremely detrimental. Chemicals in tobacco smoke damage the walls of your arteries, making them more susceptible to plaque buildup. It also lowers HDL cholesterol and increases LDL and triglycerides. Even exposure to secondhand smoke can be harmful. Excessive alcohol consumption can raise triglyceride levels and contribute to high blood pressure. While moderate alcohol intake, particularly red wine, has sometimes been linked to heart benefits, for seniors, it's crucial to discuss alcohol consumption with a doctor, as too much can be counterproductive and interact with medications. Beyond these direct factors, certain underlying health conditions frequently seen in seniors can also increase the risk of high cholesterol and atherosclerosis. Diabetes, for instance, can lead to higher levels of unhealthy cholesterol and triglycerides and damage blood vessel walls. High blood pressure, or hypertension, also injures artery walls, making them more likely to accumulate plaque. Kidney disease and an underactive thyroid, hypothyroidism, can also affect cholesterol levels. It's important to remember that these risk factors often work in combination. For example, a senior with a genetic predisposition who also consumes an unhealthy diet, doesn't exercise, and has diabetes faces a significantly higher risk. The good news is that by understanding these factors, we can strategically address the modifiable ones and work closely with healthcare providers to manage the non-modifiable risks and underlying conditions. Taking a proactive approach to these causes is fundamental to preventing the progression of atherosclerosis and its complications. One of the challenging aspects of high cholesterol and early atherosclerosis is that they are often silent killers. This means they usually don't present with obvious symptoms in their initial stages. You could have high cholesterol for years without knowing it, which is why regular screening is so vital. However, as atherosclerosis progresses and begins to significantly narrow arteries or form clots, symptoms can emerge. These symptoms are not directly from the cholesterol itself, but rather from the reduced blood flow to different parts of the body or from complications like a heart attack or stroke. Let's discuss some of these potential signs. If atherosclerosis affects the arteries supplying your heart, you might experience angina, which is chest pain or discomfort. This can feel like pressure, squeezing, or fullness in the chest, often triggered by physical activity or emotional stress, and relieved by rest. Shortness of breath, fatigue, and pain in your arms, back, neck, jaw, or stomach can also be signs. If the blood flow to your brain is compromised, you might experience symptoms indicative of a stroke or a transient ischemic attack, often called a mini-stroke. These can include sudden weakness or numbness on one side of your body, difficulty speaking or understanding speech, vision problems, severe headache, or loss of balance. These are medical emergencies requiring immediate attention. When arteries to your legs are affected, it's called peripheral artery disease, PAD. Symptoms typically include leg pain, cramping, or numbness, especially during walking or exercise, which usually subsides with rest. Other signs can be coldness in the lower leg or foot, sores on the legs or feet that don't heal, or a change in skin color. If atherosclerosis affects the arteries to your kidneys, it can lead to high blood pressure or kidney failure. Given that high cholesterol often has no symptoms, how do we diagnose it? The most crucial diagnostic tool is a simple blood test called a lipid panel or lipid profile. This test measures your total cholesterol, LDL, HDL, and triglycerides. Your doctor will likely recommend this test after a 9 to 12-hour fast. For seniors, it's generally recommended to have a lipid panel checked every 5 years, or more frequently if you have risk factors or are already on medication. For diagnosing atherosclerosis and assessing its severity, other tests may be used, especially if symptoms are present. These include an electrocardiogram, ECG, to check the heart's electrical activity, a stress test to see how your heart responds to exertion, an ankle brachial index, ABI, to check for PAD by comparing blood pressure in your ankle and arm, and sometimes more advanced imaging like an ultrasound, CT scan, or MRI of the arteries. In severe cases, an angiogram, which uses dye and X-rays to visualize blockages, might be necessary. The key takeaway here is the importance of regular medical checkups and open communication with your doctor, even if you feel perfectly fine. Early detection through routine screenings is your best defense against the silent progression of these conditions. Don't wait for symptoms to appear. Be proactive about your heart health. Even with genetic predispositions, even the natural effects of aging, there's immense power in lifestyle choices when it comes to managing high cholesterol and preventing atherosclerosis. These home and lifestyle solutions are often the first line of defense and can significantly improve your heart health. Let's start with diet, which is arguably the most influential factor. The goal is to eat heart healthy. This means focusing on foods that naturally lower cholesterol and avoiding those that raise it. Prioritize fruits, vegetables, and whole grains. These are packed with fiber, which helps reduce LDL cholesterol. Aim for at least 5 to 9 servings of fruits and vegetables daily. Incorporate lean proteins like fish, poultry, without skin, beans, lentils, and nuts. Fatty fish, such as salmon, mackerel, and sardines, are excellent sources of omega-3 fatty acids, which can lower triglycerides. Limit saturated fats, found in red meat, full-fat dairy, and butter, and eliminate trans fats, common in processed and fried foods. Instead, choose healthy fats, like those found in olive oil, avocados, and nuts. Consider adopting a Mediterranean or DASH diet pattern, both of which are rich in plant-based foods, healthy fats, and lean proteins, and have been shown to be highly effective for heart health. For example, replacing a greasy burger with grilled fish and a large salad can make a significant difference. Portion control is also key. Even healthy foods can contribute to weight gain if consumed in excess. Next, let's talk about physical activity. Regular exercise is incredibly beneficial for seniors. It helps increase your good HDL cholesterol, lowers bad LDL cholesterol and triglycerides, helps maintain a healthy weight, and improves blood pressure. Aim for at least 150 minutes of moderate intensity aerobic activity, like brisk walking, swimming, or cycling per week. This can be broken down into 30 minutes, 5 days a week. Also, include muscle strengthening activities at least twice a week. It's important to choose activities you enjoy and that are safe for you. If you haven't been active, start slowly and gradually increase duration and intensity. Consult your doctor before starting any new exercise regimen. Even simple activities, like walking around the block, gardening, or taking the stairs, can add up. Weight management is closely linked to diet and exercise. Losing even a small amount of weight, typically 5 to 10% of your body weight, can significantly improve cholesterol levels and reduce your risk of heart disease. Focus on sustainable changes rather than restrictive crash diets. Remember, a healthy weight is not just about aesthetics, it's about reducing the strain on your heart and circulatory system. Smoking cessation is non-negotiable for heart health. If you smoke, quitting is the single most impactful step you can take. Smoking damages blood vessels, lowers HDL, and significantly increases your risk of heart attack and stroke. It's never too late to quit, and there are many resources available to help you. Similarly, alcohol moderation is important. If you drink alcohol, do so in moderation. Up to 1 drink per day for women and up to 2 drinks per day for men, especially after discussing it with your doctor. Excessive alcohol consumption can raise triglycerides and blood pressure. Finally, stress management plays a crucial role. Chronic stress can contribute to high blood pressure and other risk factors for heart disease. Incorporate stress-reducing activities into your daily routine, such as meditation, yoga, deep breathing exercises, spending time in nature, pursuing hobbies, or connecting with loved ones. Prioritizing quality sleep, typically 7 to 9 hours per night, also supports overall heart health. These home and lifestyle changes are powerful tools in your health arsenal. They require commitment and consistency, but the rewards, a healthier heart and a more energetic life, are well worth the effort. Start small, be patient with yourself, and celebrate every positive change you make. While lifestyle changes are incredibly powerful, for many seniors, medical interventions are also necessary to effectively manage high cholesterol and atherosclerosis, especially if lifestyle modifications alone aren't sufficient or if the disease is more advanced. It's crucial to work closely with your healthcare provider to determine the best course of action. Let's explore some of the common medical solutions. Medications are often the cornerstone of treatment. The most widely prescribed drugs for high cholesterol are statins. Statins work by reducing the amount of cholesterol your liver makes. They are highly effective in lowering LDL cholesterol and also help stabilize plaque in the arteries, reducing the risk of heart attacks and strokes. Common statins include atorvastatin, simvastatin, and rosuvastatin. Like all medications, statins can have side effects such as muscle pain or liver issues, but these are often manageable, and the benefits usually outweigh the risks.
Your doctor will monitor you closely. Other medications may be used if statins aren't tolerated or aren't enough. Ezetimibe works by reducing the absorption of cholesterol from food in your intestines. PCSK9 inhibitors are newer, powerful injectable drugs that dramatically lower LDL cholesterol, often used for people with very high cholesterol, genetic cholesterol disorders, or those who can't tolerate statins. Fibrates primarily lower triglycerides and can slightly increase HDL. Niacin, a B vitamin, can also lower LDL cholesterol and triglycerides and raise HDL, but it often has side effects like flushing, which can be bothersome. Bile acid sequestrants are another class that works in the intestines to remove cholesterol. Beyond cholesterol-specific medications, it's vital to manage coexisting conditions that exacerbate atherosclerosis. Controlling high blood pressure is paramount. Medications like ACE inhibitors, ARBs, beta blockers, and diuretics are commonly prescribed to keep blood pressure within a healthy range, thereby reducing stress on arterial walls. For seniors with diabetes, strict blood sugar control is essential. Uncontrolled diabetes significantly accelerates atherosclerosis, so diabetes medications, diet, and lifestyle are all critical components. Additionally, for individuals with established heart disease or significant risk, doctors may prescribe antiplatelet medications, such as low-dose aspirin, to help prevent blood clots from forming in narrowed arteries, which could lead to a heart attack or stroke. However, aspirin therapy should only be initiated under a doctor's guidance due to bleeding risks. In more advanced cases of atherosclerosis, where arteries are severely narrowed or blocked, procedures may be necessary to restore blood flow. Angioplasty and stenting are common minimally invasive procedures. During an angioplasty, a thin tube with a balloon is inserted into the affected artery and inflated to widen it. Often, a small mesh tube called a stent is then placed to keep the artery open. For very severe blockages, especially in the heart's arteries, coronary artery bypass graft,
CABG surgery might be required. In this major surgery, a healthy blood vessel from another part of the body is used to create a new path for blood to flow around the blocked artery. These procedures are reserved for specific situations and are discussed thoroughly with your cardiology team. Regular monitoring and follow-up with your healthcare team are absolutely essential, regardless of the treatment approach.
This involves routine blood tests, blood pressure checks, and discussions about your symptoms, medication adherence, and any side effects. Your doctor will adjust your treatment plan as needed to optimize your heart health. Remember, medical solutions are powerful tools, but they work best when combined with dedicated lifestyle changes. This integrated approach offers the most comprehensive protection against the progression of high cholesterol and atherosclerosis.
Prevention is truly better than cure, especially when it comes to conditions like high cholesterol and atherosclerosis that develop silently over many years. For seniors, prevention is about not only preventing the initial onset, but also slowing the progression of existing conditions and averting severe complications. It's an ongoing, active process that combines everything we've discussed. Let's outline key prevention strategies. The first and most foundational strategy is adopting and maintaining a heart-healthy lifestyle from as early an age as possible, but especially in senior years. This means consistently making wise dietary choices, prioritizing whole, unprocessed foods, ample fruits and vegetables, lean proteins, and healthy fats, while limiting saturated and trans fats. It means engaging in regular physical activity that is appropriate for your fitness level, aiming for a mix of aerobic and strength-building exercises. It means striving for and maintaining a healthy body weight. For those who smoke, quitting is the single most impactful preventative measure. And for those who drink alcohol, moderation is key. Secondly, regular health screenings are indispensable. As we discussed, high cholesterol often has no symptoms. The only way to know your cholesterol levels is through a lipid panel blood test. Seniors should discuss with their doctor the appropriate frequency for these tests, typically every 5 years, or more often if risk factors are present. These screenings allow for early detection and intervention before significant damage occurs. Thirdly, proactive management of coexisting conditions is a critical preventive step. If you have high blood pressure, diabetes, or kidney disease, working closely with your doctor to keep these conditions well controlled is paramount. Uncontrolled chronic conditions significantly accelerate the development and progression of atherosclerosis.
This often involves a combination of medication, dietary adjustments, and regular monitoring. Fourthly, stress management and adequate sleep play a supportive yet important role in prevention. Chronic stress can contribute to inflammation and other risk factors for heart disease. Incorporating relaxation techniques and ensuring you get 7 to 9 hours of quality sleep each night can bolster your body's overall health and resilience. Fifthly, education and awareness are powerful tools. Understanding your personal risk factors, knowing the signs and symptoms to look out for, and staying informed about healthy living practices empowers you to take an active role in your health. Talk to your family about their health history to understand any genetic predispositions. Finally, and most importantly, establish a strong partnership with your healthcare team. Regular checkups are not just about addressing problems when they arise. They are about ongoing preventive care, personalized advice, and adjusting your health plan as your needs change over time. Your doctor can help you set realistic goals, monitor your progress, and provide the necessary medical support. Prevention of high cholesterol and atherosclerosis in seniors is a lifelong journey. It requires consistent effort and a holistic approach, but the benefits, a strong, healthy heart, and a better quality of life are invaluable. By embracing these strategies, you are investing in your long-term well-being. We've covered a lot of ground today, from understanding the basics of cholesterol and atherosclerosis to exploring causes, symptoms, and a wide array of management and prevention strategies. The journey to a healthy heart, especially as we age, is a continuous one, and it's built on knowledge, proactive choices, and a strong partnership with your healthcare provider. Remember, high cholesterol and atherosclerosis are common, but they are not inevitable consequences of aging. You have the power to influence your heart health through the choices you make every day. Embrace a heart-healthy diet. Stay physically active. Maintain a healthy weight. Avoid smoking. Manage stress, and ensure you get regular medical checkups. Don't hesitate to ask your doctor questions. Express your concerns and work collaboratively to create a personalized plan that suits your individual needs. Your heart is vital to your well-being, and by taking these steps, you are investing in a longer, healthier, and more fulfilling life. Thank you for joining us today. And remember, your health is your most precious asset.